Which class of antiarrhythmic drugs primarily works by blocking sodium channels? A. Class I. B. Class 2. C. Class 3. D. Class IV. The correct answer is A. Class I antiarrhythmics work by blocking sodium channels, which slows the conduction velocity of the cardiac action potential. What effect do beta-adrenergic antagonists have on cardiac automaticity? A. Increase automaticity. B. Decrease automaticity. C. No effect on automaticity. D. Only affect ventricular automaticity. The correct answer is B. Beta-adrenergic antagonists decrease automaticity by blocking the effects of catecholamines on the heart. Which of the following antiarrhythmic drugs is known for its potential to cause thyroid dysfunction? A. Sotalol. B. Amiodarone. C. Flecainide. D. Lidocaine. The correct answer is B. Amiodarone can cause thyroid dysfunction due to its high iodine content, affecting thyroid hormone levels. What is the primary action of class 3 antiarrhythmics? A. Increase heart rate. B. Prolong action potential duration. C. Decrease calcium influx. D. Increase sodium efflux. The correct answer is B. Class 3 antiarrhythmics primarily prolong the action potential duration by blocking potassium channels, which increases the refractory period. Which antiarrhythmic agent is often used as a first-line treatment for acute supraventricular tachycardia? A. Verapamil. B. Adenosine. C. Flecainide. D. Dofetilide. The correct answer is B. Adenosine is used as a first-line treatment for acute supraventricular tachycardia due to its rapid effect on the AV node. How do class IV antiarrhythmics primarily exert their effects? A. By blocking sodium channels. B. By increasing heart contractility. C. By blocking calcium channels. D. By prolonging the refractory period. The correct answer is C. Class IV antiarrhythmics primarily block calcium channels, which decreases conduction through the AV node and reduces heart rate. Which of the following is a common side effect associated with the use of Sotalol? A. Hyperkalemia. B. Torsades de points. C. Thyroid dysfunction. D. Hypoglycemia. The correct answer is B. Sotalol can cause torsades de points due to its effect on prolonging the QT interval. Which antiarrhythmic drug is contraindicated in patients with structural heart disease due to its proarrhythmic potential? A. Amiodarone. B. Flecainide. C. Lidocaine. D. Dofetilide. The correct answer is B. Flecainide is contraindicated in patients with structural heart disease because it has a higher risk of causing life-threatening arrhythmias. What is the mechanism of action of digoxin in the treatment of atrial fibrillation? A. Inhibiting sodium-potassium ATPase. B. Blocking sodium channels. C. Enhancing calcium influx. D. Blocking potassium channels. The correct answer is A. Digoxin inhibits sodium-potassium ATPase, leading to increased intracellular calcium and decreased heart rate through enhanced vagal tone. Which of the following drugs is most likely to cause pulmonary toxicity as a side effect? A. Sotalol. B. Amiodarone. C. Prekinamide. D. Diltiazem. The correct answer is B. Amiodarone is known to cause pulmonary toxicity, including pneumonitis and pulmonary fibrosis, especially with long-term use. What characteristic makes class IC antiarrhythmics particularly useful in treating ventricular arrhythmias? A. Minimal effect on action potential duration. B. Rapid onset of action. C. Prolongation of the refractory period. D. High safety margin in structural heart disease. The correct answer is A. Class IC antiarrhythmics have minimal effect on action potential duration while effectively suppressing arrhythmias, making them useful for ventricular arrhythmias. Which of the following is a potential drug interaction of amiodarone? A. Increased effect of digoxin. B. Decreased effect of beta blockers. C. Increased effect of calcium channel blockers. D. No known interactions. The correct answer is A. Amiodarone can increase the levels of digoxin, leading to a higher risk of digoxin toxicity. Which antiarrhythmic agent is primarily used for the management of life-threatening ventricular tachycardia? A. Lidocaine. B. Flecainide. C. Dofetilide. D. Adenosine. The correct answer is A. Lidocaine is often used in acute settings for the management of life-threatening ventricular tachycardia due to its rapid action and effectiveness. What is the primary goal of antiarrhythmic therapy in patients with atrial fibrillation? A. Increase heart rate. B. Restore sinus rhythm. C. Control ventricular rate. D. Prevent thromboembolism. The correct answer is C. While restoring sinus rhythm is important, the primary goal often includes controlling the ventricular rate to prevent symptoms and complications. Which class of antiarrhythmic drugs is contraindicated in patients with a prolonged QT interval? A. Class I. B. Class II. C. Class III. D. Class IV. The correct answer is C. Class III antiarrhythmics, which prolong the QT interval, are contraindicated in patients with a history of or existing prolonged QT interval due to the increased risk of tossage points. Which drug can be used for both rate control and rhythm control in atrial fibrillation? A. Amiodarone. B. Adenosine. C. Propanolol. D. Diltiazem. The correct answer is A. Amiodarone can be used for both rate control and rhythm control in atrial fibrillation, making it a versatile choice in treatment. What is a major adverse effect associated with the use of dofetilide? A. Increased heart rate. B. Acute kidney injury. C. Hypotension. D. Hepatic failure. The correct answer is B. Dofetilide can lead to acute kidney injury, necessitating renal function monitoring during therapy.